I'm with Dr. Betsy Rodriguez. She is the course director of the ASGE's annual postgraduate course taking place on Monday. Thank you so much for being here.
Thank you for having me.
Can you give us an overview of what will be happening on Monday?
Sure. We very carefully selected a broad range of topics that I think are going to appeal to all gastroenterologists, whether they're in private practice or at the cutting edge of academic medicine. We're going to have 15-minute lectures, so there will be plenty of different topics. And after each section, whether it be esophageal section or colon section, then we'll have a live demonstration of the techniques that were described during the lectures to really solidify what happened.
Will this be interactive?
It will be interactive. Our world-renowned endoscopists will be out at the new ASGE IT&T Center performing live cases. And I think the very exciting thing about that is that we're going to get to see new devices and new techniques being used in real time.
It seems to have a very practical bent. I mean, can this help people in practice now?
Yes, and that was one of our big goals, is to make sure that this is not so cutting edge that it's not practical for people who are actually practicing medicine. We wanted to make sure that we explore very new techniques, but also find out how those can integrate into our practice. For example, one of the later topics is talking about advanced imaging and how this can fit into your practice. We've all heard about NBI and autofluorescence imaging and those kinds of things, and some of us are maybe not so sure how that can fit into our practice at home. So we're going to discuss those kinds of things as well.
What amazes me, I mean, I looked at the day that you have every 15 minutes you're moving on to a new technique.
Right. It's hard to sit in a dark room all day, so we have to keep people interested. And,
you do,
yeah.
And it's so wide-ranging. What do you think are some of the hot topics that you'll be discussing?
Yeah, well, I think we did go through the basic topics such as foreign bodies and GI bleeding and those kinds of things, but we tried to give them a little bit of a twist, such as for foreign bodies, what can be left in? And I think this is a topic near and dear to most of our hearts who were on call and you want to know, do I have to get up or not? So we did go through a broad range of topics and things that are basic, but also try and give it a little bit of a twist.
That's the type of thing at 2 a.m. in the morning is definitely very practical.
Oh yes, yeah, you could definitely reach back on that and decide if you're going to get up or not.
Your specialty, I know, is pancreas and biliary. Anything really new or exciting in that area?
Sure. We're going to just discuss things like the indeterminate biliary stricture. There are some new imaging techniques that we can use to help diagnose what to do with those people, because a lot of those patients face an uncertainty of whether they're waiting on an indolent malignancy and do they really need a surgery, or are they going to have a very large unnecessary surgery for a benign disease. So some new imaging techniques there. We're going to discuss things like acute recurrent pancreatitis, which I think is such a, it can really plague people in practice. People keep coming in with pancreatitis and it's unknown why, so we're going to talk about things like that are of use practically.
I'll talk about a very full day. I'm sure it'll be very exciting for you, Doctor.
Yeah.
Thanks so much for being here.
Thank you.
Thank you. Now, if you want to follow DDW, please visit our blog site on the web, or you can follow us on Twitter at #DDW14.